State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases. And so we've invited our health department staff to come and give a presentation today and inform the court and the public about this new definition. Aisha, how are you?
Good, how are you?
Thanks for joining us.
Yeah, no problem. Again, my name is Aisha. I am with the epidemiology department with Healthcare Services. So this image here will show you the current case definition. So currently, a confirmed case of COVID-19 was considered confirmed. If they got the swab testing done and it came back positive, that would be what we counted as a case towards COVID-19. So regardless of the contact you may have had with a confirmed case or symptoms, if there was no testing, you were not counted as a case. So in this image, we have the confirmed case and their possible contacts. And the total cases out of this is only one. The new case definition. So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. They also updated the definition for deaths related to COVID-19. Previously, prior to this definition, it was only if you had a positive PCR result that you would be counted as someone who died related to COVID-19. Now that lab testing is no longer required to be counted towards that. It's just an overview, gets kind of confusing. So this is the different options that we have for probable case definition. So the clinical criteria that they have defined is at least 2 symptoms of fever, subjective or measured, chills, rigors, myalgia, headache, sore throat, or new smell and taste disorders, or cough, shortness of breath, difficulty breathing, or evidence of pneumonia. So there's many ors and then there's many ands. So in order to be counted as, to see if you meet the EpiLink definition.
If someone has 2 minor symptoms or 1 major symptom, that qualifies. Fever, headache, sore throat, chills. And fever, by the way, can either be measured fever or subjective fever. They just feel like they've got a fever. If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now.
Mm-hmm. So that same scenario, a little bit more extended. Now if we look at it with the new probable case definition, there's a total of 17 cases now. 1 is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
The yellow person there is the only one on the board who has a positive PCR test. It's the only one that's tested positive with a true swab test for COVID-19. All of the orange boxes are coworkers and family members and neighbors and friends, folks that have had some kind of contact with the confirmed case, which is represented by 1 individual on this chart. That could be expanded 16-fold here on this one chart, just as an example of how it could happen. Now that could be overstating it. It could only expand 10-fold or 5-fold. And if you're just doing that for reporting, well, it's not reliable. So once you've gotten to the point of more widespread testing, it runs counterintuitive to this, that you would bring in a probable definition at the same time that you now have the most testing capacity that you've ever had. That seems to not match up well.
Yeah.
Is that accurate? Yeah. So this is a little bit of history for the court. The definition, this probable case definition, was adopted by the Council of State and Territorial Epidemiologists back in early April 4th or 5th. They adopted this. They sent it to the CDC, and the CDC did take that recommendation and adopt it and sent it out to the various states for consideration. And so now Texas DSHS has adopted this definition and will be using it.